BPH is the non-cancerous enlargement of prostate. It is a condition which affects men only, and the older a man gets, the more likely he is to have symptoms related to BPH. These symptoms are not life-threatening, which is why people are not really bothered about it, but one thing they don't understand is it interferes with their quality of life significantly. So an old person, very important for them to have a good night's sleep and not have a leakage when they're trying to pass urine or things like that. So if you're having symptoms related to this, you need a urology consultation. If your symptoms are mild, even moderate symptoms can be easily managed by medications that are not very expensive and control your symptoms very well. But if your symptoms are severe, you will require surgery. So when it comes to the surgical options for the treatment of BPH, on one side you have a surgery called as TURP. It is an endoscopic surgery in our hospital which is very commonly done. For a patient who is undergoing TURP, he requires basically about 2 to 3 days maximum of admission. It is a surgery which has stood the test of time. It has been done for decades together throughout the world. It is still the most commonly done surgery in the world for prostate enlargement, and if it is done correctly, it is associated with negligible complications, and most importantly, it does not require any further treatment later on, and it will permanently cure your symptoms. On the other hand, there are a lot of newer treatment modalities which are being aggressively marketed by a lot of hospitals. So you keep hearing about water vapor, aquablation, needle ablation, laser treatment, and so on and so forth. Most of these treatments, in fact almost all of them, are much more expensive than the conventional treatment, and most of the times they are not even applicable to all sort of prostates. They are applicable only a small subset of patients, and even in them there is a chance of requiring retreatment. So imagine having to undergo the same procedure 2 times, 3 times, already having to spend a lot of money for this. So I know they are marketing these newer approaches quite well, but please don't fall for that. There is something which is tried and tested, which is something that everybody swear by. Here at Ananthapuri Hospital, we are known to have a very patient-centric approach, and we will always prioritize your well-being over trying out experimental and expensive treatment. So for quality urological care, please visit us at Department of Urology, Ananthapuri Hospital. Thank you.